Hi there, viewers! Did you know your heart is approximately the same size as your fist? The heart is a vital organ that pumps around 2,000 gallons of blood per day. It beats around 115,000 times daily. It's also extremely fragile. Every bite of food that goes inside your mouth can change the way your heart functions. In today's video, we'll have a look at the causes of heart disease. Is it cholesterol, LDL, HDL, insulin? We're talking all these and more. Let's begin. What does a healthy heart look like? Well, here are a few facts about the heart to start off. The heart is a tubular organ with valves. It's located under the ribcage on the left side between your lungs. The heart is made up of 4 chambers. The upper 2 are called atria and the lower 2 are called ventricles. These 4 chambers together keep pumping blood day in and day out, non-stop without any break. Did you know that the heart can continue beating even when disconnected from the body? Share your reply with the Bestie community in the comments below. Until the day you die, your heart beats continuously without rest. To maintain this rhythmic movement, the heart has specialized cell bundles called SA and AV nodes. These nodes initiate electrical impulses in the heart and keep the heart pumping. In short, these nodes act as power switches, sending signals to the heart to contract and relax. A healthy heart needs nutrition too. Coronary arteries are vessels or blood channels which feed the heart with nutrients and oxygen. These blood vessels are the real causes behind cardiovascular disease or heart disorders. What does the heart do? Your heart has the most important function. It has to provide nutrients and oxygen to the entire body, including the tiniest cells. This occurs by the contraction of heart muscles, called myocardium. A contracting heart squeezes impure blood received from the body into the lungs for oxygenation and purification. The oxygenated blood is then pumped to the entire body by your heart. The organ has to work continuously since the human body needs nourishment and oxygen at all times, even during sleep. What is cholesterol? Cholesterol is a waxy substance found in your blood. It's a common misconception that cholesterol is bad. It is definitely not. Cholesterol is needed by the body for cell building, producing hormones and vitamins. But like all things, too much of it puts your heart in danger. Cholesterol comes from 2 sources. All the cholesterol we need is made by the liver. The rest comes from meat and dairy products. So why is cholesterol important? Since cholesterol circulates in the blood, too much of it increases the chances of stroke and heart disease. Looking for answers on all the latest health and wellness news? Hit that subscribe button and join our millions of followers. Stay up to date on all our great Bestie content. So what are LDL, HDL, and triglycerides? Cholesterol cannot move in your body on its own. It needs a transporter, a specialized type of protein called the lipoprotein. There are 2 types of lipoproteins that transport cholesterol. There's low-density lipoprotein, LDL, and high-density lipoprotein, HDL. If you break them open, they contain cholesterol and triglycerides. LDL transports cholesterol to all the cells in the body and is broken down by the liver. It's considered bad cholesterol because it deposits onto the walls of your arteries, causing them to narrow. This forces the heart to work harder in order to pump blood. HDL, or the good cholesterol, also carries LDL away from the arteries and back to the liver for breakdown, but not all LDL can be taken away by HDL. Triglycerides are the most common fat in the body. They function by storing excess energy from your food. What is insulin? Insulin is a hormone with metabolic effects on the body. That means it helps the storage of nutrients in the body, which break down later on. It's produced by special cells in the pancreas called beta cells. Insulin plays a significant role in the breakdown of carbs and fats in your body. It gives power to glucose in the liver. It also controls free fatty acids. Most of the time, insulin is related to diabetes. In type 1 diabetes, not having enough insulin causes poor glucose use. In type 2 diabetes, insulin production is there, but not enough is produced to meet the body's demands. Before we move ahead, here's another video you might like. Learn more about the best sources of vitamin C by watching 10 top vitamin C-rich foods you need to eat. Now back to our video on heart disease. What's the role of LDL, HDL, and insulin in heart disease? LDL deposits cholesterol into the walls of your artery. As I mentioned a minute ago, this causes the narrowing or clogging of arteries. Recent studies show that it's not just bad LDL that causes heart disease. Only certain conditions make this fat-transporting LDL look like a villain. The bigger and often overlooked culprit is sugar or simple carbohydrates. When a person consumes excessive carbohydrates, it leads to an insulin spike. When this happens over a long period of time, it leads to development of insulin resistance. Insulin resistance causes poor utilization of sugars by the body, which in turn causes more insulin to rise. This vicious cycle has dangerous effects on the body's metabolic health. People with insulin resistance have higher triglyceride levels and low HDL. This causes a specific change in LDL. In patients of insulin resistance, it's seen that the LDLs turn to a smaller, more dense size. This smaller and more dense LDL is the king of all villains. In such a metabolic environment, these LDL particles are not efficiently taken back to the liver for breakdown, thus they keep circulating in the bloodstream for a longer duration. These smaller, more dangerous LDLs find it easier to enter the walls of arteries to cause atherosclerosis, harming the health of vessels and your heart too. In other words, too much sugar in your blood is simply bad news for you and your heart. A person with insulin resistance will usually suffer from obesity and poor waist-to-hip ratio. It's not just fats that lead to heart disease, it's glucose as well. Other causes of heart disease. There are many factors that lead to heart disease. Some are treatable, some aren't. The factors out of our control are things like old age and genetics. Males are also more likely to suffer from heart disease. Treatable factors include cigarette and alcohol consumption and poor diet. Other causes of heart disease include stress, lack of sleep, and obesity. These are all things you can change around by eating healthier and being a little more active. You can also try going to bed a little earlier. What are other ways you can keep your heart healthy? Well, like I said, you need to try and be more active. Work out at least 30 minutes a day. Try sticking to a routine and keeping your eye on your weight. Avoid fried and sugary foods. Get a lot of nutrients, fibers, and essential vitamins from fresh fruits and vegetables. Meat, eggs, fish, legumes, and dairy products can be a great source of protein and healthy fats. If you're a hard partier, try cutting back on the smokes and booze. Inhaling cigarette smoke or even secondhand smoke can also cause your heart to deteriorate. Another important thing is to lower your stress as best you can. Practice meditation and yoga to keep your mind calm and peaceful. Maintain good oral hygiene as bacteria from your mouth can infect your heart. Rejuvenate your body with at least 8 hours of deep sleep. If your job requires you to sit at a desk, try standing up and walking around once in a while. This is especially important for those who don't get a lot of exercise. Heart disease is scary. You want to avoid it at all costs. We should probably talk more about heart-healthy foods you can eat. Most of these foods you can get at your local grocery store. Have I sparked your interest? Let's keep the conversation going with a couple more heart-related videos, shall we? Check out 8 foods that will give you a heart attack. You can also try 9 ways garlic can help your heart. Go ahead, click one, or better yet, watch both and learn more about how to avoid heart disease. What do you do for your heart health? Let us know in the comments below.